The symptoms happen quickly, and delaying medical treatment can drastically change your outcome of a stroke. It's a possibility that some begin fearing with age. WSBT 22's Ann Reed joins us in studio with this month's Eye on Health, and experts told you everyone needs to be aware of the warning signs.
Well, the Beacon Health System doctor I spoke with says a typical stroke patient is above 65 with other conditions like a history of diabetes, high cholesterol, or hypertension. A stroke can happen to anyone, anywhere.
You can usually find Andrew Nemeth in the classroom, teaching his Penn High School students in the choir room. On any given day, he expects lesson planning, rehearsals, and an overall busy schedule. What he didn't expect was to have a stroke at age 36.
I had taught 2 classes that day. I felt totally fine, and then as soon as my prep period, which is or the lunch period, started, I just started to feel dizzy and lightheaded.
Soon after, a colleague joined him for lunch and noticed Nemeth was slurring his words. After talking to the school nurse, they called 911 and he was taken to Memorial Hospital.
I definitely was not thinking that I was having a stroke at 36 years old at the time.
But he was, and it stemmed from something called a PFO, a small hole between the upper chambers of the heart that usually closes shortly after you're born. Nemeth's, however, remained open.
Such as in the case of our patient, Mr. Nemeth. So he went through that diagnostic evaluation, and then we were able to then, after looking at an ultrasound that required us to look at it through what's termed a transesophageal echocardiogram, we found that he had what's termed a patent foraminal valley and an interatrial septal aneurysm.
Luckily, the Beacon Stroke team was able to give Nemeth the care he needed, and quickly. They were able to give him a medication to dissolve the clot that cut off the blood supply to his brain. Dr. Luis Lopez says it's the speed of which someone can recognize the symptoms or recognize they need help and get to the hospital that plays a huge role in their outcome. For every 15 minutes that goes by, there's a 4% likelihood of increase in disability. That's why he says it's important everyone knows the acronym BE FAST. B for balance, E for eyes, F for face, A for arm, S for changes in speech, and T is time to call 911. Be Fast helps you to recognize the main signs of a stroke, including facial drooping, arm weakness, and speech difficulty. Like Nemeth's colleagues who knew he needed help, because you never know who it could happen to.
I just didn't think it could happen to somebody that young, to be honest. You have to realize a stroke can happen to anybody at any time. As soon as you see symptoms, you need to act. I still feel that I'm not quite back to 100%, mainly with energy and stamina, but I can tell at this point that I have made significant gains in energy, and honestly, I'm just more grateful for my opportunity at life.
Experts tell me there are ways to lower your chance of a stroke, including avoiding smoking, watching your diet, exercising, and getting a good amount of sleep. John.